Bienvenidos and welcome to our webinar on reimagining service delivery for Hispanic families during the time of COVID. My name is Lina Guzman, and I am the director of the National Research Center on Hispanic Children and Families, and I'll be facilitating today's webinar. Next slide, please. But first, I want to start with a few logistics. To make sure that our audio is clear and free of interruptions, we're going to be muting everyone throughout the webinar, but feel free to type in questions for the panelists in the question box at the bottom. We will be answering questions as possible throughout the webinar, and also we'll leave a sufficient time at the end of the webinar or towards the end of the webinar to answer as many questions as possible. In case you missed anything, the webinar will be recorded and available on our website to share with others later next week. Next slide, please. And just to note that the views expressed in this webinar don't necessarily represent those of our funders, the Office of Planning, Research, and Evaluation within the Administration for Children and Families in the Department of Health and Human Services in the U.S. Next slide, please. The mission of the National Research Center on Hispanic Children and Families is to conduct research and provide research-based information to inform programs and policies supporting low-income Hispanic children and families. You can learn more about the center and its research, as well as other activities, at our website at www.hispanicresearchcenter.org, or you can follow us on Twitter at NRC Hispanic. Next slide. So as many of you know, Latinos have been hard hit by the pandemic. Over half of Latino adults report that they or someone in their household has lost a job, they've had their work hours cut, or also had wages lost. Latino workers are also overrepresented in the essential frontline jobs, such as in groceries and warehouses, bus and transit, as well as in hospitals and the hospital industry. We also know that unauthorized immigrants and many mixed status families are ineligible for relief under the CARE Act. And so just to put this into context, research that the center has done shows that 1 in 4 of all Hispanic children have at least one parent who is an unauthorized immigrant. And preliminary data also suggests that Latinos have some of the highest rates of confirmed cases of COVID and the second highest rate of mortality for COVID. These data are definitely emerging and definitely are changing from week to week and vary a lot by states, but this is based on the data to date. So all of us have been hard hit by the pandemic, but Latinos have been especially hard hit, which brings us to the goal of this webinar. Next slide, please. So the goal of today is to highlight strategies that have been used by programs that are serving large proportions of Latino families to reach and support these families during the pandemic. And our hope is that the information that you hear today will be useful for your programs and others in your communities about how to best serve Latinos during this very difficult and challenging time. So I'd like to introduce our presenters, our wonderful panelists, and I'm going to be starting with Teresa Granillo, who is the Chief Executive Officer of AVANCE, a nonprofit whose aim is to break the cycle of intergenerational poverty among low-income Latino families and by providing 2-gen family engagement programming that combines early education as well as parenting. Next is Juan Prandoni, who is the Training Director of Futuro, a mental health nonprofit serving the Latino community in Durham, North Carolina. At Futuro, Juan has worked to improve the capacity of providers to provide culturally responsive services throughout a variety of web-based trainings. And welcome, Juan. And Maria, I promise you I will massacre your last name at some point. Maria Santos Arellano-Buchanan is the Vice President of Expansion at Family Bridges, whose aim is to build strong communities by promoting healthy marriages and strong family relationships while embracing cultural and spiritual values. Welcome, Maria. And last but not least, we have Diego Uriburu, who is the Executive Director and Co-Founder of Identity, which is a nonprofit right here in our backyard in Montgomery County, Maryland, which provides academic support and social services to Latinx youth and families and their families. welcome everyone. Okay. If everyone can mute themselves if you're not talking, I think that will help with the background noise. So my first question to all of you is, why don't we start talking about how the pandemic has changed, how you've changed the way, how your organization thinks about the way that it needs to deliver services, as well as the types of services. All right, I think I may have accidentally muted myself. So I'm going to start over. I just want to start with a very broad question, asking the panelists, each of the panelists, how the current pandemic has changed the way that your organization thinks about service delivery for Latino families and how you're implementing that. Why don't we start with Teresa? AVANCE's hallmark program is the parent-child education program, which consists of parenting classes as well as early education. Can you tell us about how the services at AVANCE that AVANCE provides have changed because of the pandemic?
Thank you. Sorry, we got it. No, sorry about that. So yeah, our traditional programming, like most of our panelists here, was live in person, and we had to shift very quickly from being a parent education and early childhood education organization to being a basic human needs services organization. And so we first started off with doing needs assessments of all of our families to make sure that they were okay, that they had food, that they had diapers and shelter. So we partnered with local food banks to make sure that we were getting food to our families, getting them diaper assistance. And then we also partnered with the Family Independence Initiative for direct cash assistance. A lot of our families weren't eligible for the stimulus checks that were being sent out and needed cash assistance very quickly. And so we were able to, through that partnership with Family Independence Initiative, we were able to get $125,000 of cash assistance out to our families in a very quick manner. And then in terms of just programming, we'll talk about it later, but everything had to go virtual, and that included our parent-child education program. And so everything shifted, but we really focused on their needs, basic human needs first.
Oh, sorry, I was on mute. Sorry. Diego, thank you, Teresa. Diego, I want to ask you a similar question. At Identity, can you tell us a little bit about the ways in which you had to shift the focus of the services that you provide Latino youth and families in Maryland? Diego, I think you're muted.
Okay, now are you able to hear me?
Yeah.
So, likewise, we had to do a dramatic shift to meet our clients' basic needs. Within 2 weeks, our families were going hungry, and that was the first thing that hit them hard. And within the end of the month, people were really struggling with hunger issues and also with issues of housing. As with Teresa, the majority of our clients did not receive checks from the federal government, and also they did not qualify for unemployment services. So within a month or so, we probably distributed around $500,000 in rental assistance, food. But in addition to that, we also went on a campaign. There was a lot of disinformation about COVID. So all of our staff was trained in the basic COVID information, so we can provide that information to our families. But we also began to see a spike in mental health needs. So we also shifted and we trained all of our staff on what we call community mental health, so that our staff can begin, even the staff was not licensed, but we felt that every staff member could really play a role in providing emotional support to our clients. And the last area where we also worked very hard on is education. What some of our families, or the majority of our families, were really hard hit, or are still being hard hit due to COVID in terms of education. They did not have computers, Wi-Fi. So we work with local foundations and also with the school system to ensure that most of the young people that we serve and others have access to computers and Wi-Fi. So that's in a nutshell what we have been doing.
Thank you, Diego. Maria, let me turn to you now. So Family Bridges focuses on providing healthy relationship classes. Can you say a little bit about how some of your curriculum has had to change, as well as any of the services that you're providing during COVID? You're on mute, Maria.
Good. Thank you. We call our couples and families during the first week of the quarantine. And Anita, one of the family members, shared with me and said, Maria, I love my family, but don't take me wrong, please. We are going through a lot of difficulties because we are all together at home. My husband is at home, I am at home, the kids are at home. We have all kinds of chores, we have different schedules, and we also have homework. So what can I do? We're getting nuts here. So we realized with multiple phone calls to our families that we have to increase the need to address stress and anger management, conflict resolution, and how to communicate better between couples and families. So to address this, we provided Facebook live events in Spanish in series of 3 and 4. So this was weekly. The first Facebook live event in Spanish was stress management that we did in 4 times. And we were very impressed because we had more than 5,000 views after the 4 series. The other series that we had in Facebook Live in Spanish was Casados, which is House for Two, but this is a couple's conversations in an out of the norm teaching approach that use comedy on the key points. And we also refer them to our course offerings so they could pinpoint their immediate needs. And the courses were offered online based on the needs of the families. Family Bridges also supported parents by managing their children at home, as I mentioned, because they had homeschooling, homeworks, balancing work, and they have the need of parenting responsibilities. So in order to support, we provide on Facebook Live parenting workshops, and we had between 500 to 1,000 views in each one of them. So this was very impressive also for us, but very needed in our families. One of the very new programs that we have in FaceTime Live was Story Times for Kids, Once Upon a Time with Eva. We also had fun shows for the family over the weekend. So the whole family could sit and watch these delicious and fabulous concerts. And also we had theater, because we do theater, and this time we recorded and just pass it through the FaceTime or Facebook Live, and all the family could be together. One of the last resources that we shared with the families was STEAM boxes. We provide this for the kids, so kids could access to the 6 months activities that we register them to receive with educational activities and arts. So kids could focus on working on them while the parents were taking our workshops. And in that way, our families could focus and gain the skills that they needed to be a better families, better couples, better individuals.
Thank you, Maria. And many of those are things that with 2 young children, I can definitely relate to. Definitely different circumstances, but very relatable. Juan, I want to turn to you. A common theme that I'm hearing is the need to focus on basic needs, food, shelter, mental health, rental assistance, money, etc. There's also a very clear need, as Maria was talking about, mental health during the pandemic. Can you talk a little bit about the types of services that you've been providing and what are some of the challenges you face? as well as some of the successes. You're on mute. Juan, you're on mute. And, just for the audience, knowledge,
there we go.
did actually practice. We did practice. Okay, Juan, go ahead.
Yeah, I think the organizer has me muted, so I think we need to coordinate that on that end too. But anyways, yeah, thank you for the question. I think for us, so we were fortunate that Medicaid moved pretty quickly with us to adapt and provide reimbursement for services. So we were able to shift our individual and group therapy over to telehealth within about 2 weeks. And really that Medicaid funding was critical with that. And so as we switched, we really tried to meet folks where they were. So we wanted to make sure that they were continuing to get support in terms of their mental health, but then also, I mean, a lot of people had really basic needs to take care of in those early days, mid-March or so. So we have a dedicated case management team at El Futuro, and we really coordinated with them and our administrative team to get in touch with all of our clients that are being seen, and even clients that actually really all clients that have been seen since January 2019, to ensure that we were getting information out to them about food banks, food assistance, housing assistance, all of those basic life needs. Wanted to make sure that that was in place before we actually simultaneously as we were continuing to provide mental health services. On the other end, so to get this going, we had some expertise from our folks. We have a program that provides distance services or remote services to North Carolina farm workers. And those were the only folks doing teletherapy at the time. And so those were the folks within our organization that we turned to help upfit the rest of our clinical staff to do therapy like this. And luckily, we've found that it's been pretty successful. And a lot of folks have enjoyed it. There are obviously those that don't, that still prefer to meet in person. And we're looking forward to seeing those folks whenever we can. But for the ones that have been able to adapt, it's been a pretty good change in our services, and we've been able to transition pretty smoothly. With all of the work that we do, maintaining patient privacy and using systems that keep their personal health information protected is important. So we've really upfitted our services to have HIPAA compliant Zoom calls for all of our clinical staff. And we really had to also upfit a lot of work on the front end to get our clients who may not have a lot of experience with these technologies for we've gotten it down to where we get them to download Zoom, and then all they need to do is click on a link from a text that we send through our admin staff with a link to the session with the therapist. So all they do is answer that text, hit that link, and they're in the session. And that has really helped us to keep pretty close to 100% productivity from what we had pre-COVID. So those are some of the changes, I think, largely that we've made.
Thank you, Juan. Teresa, after you were able to address families' basic needs, you also turned to changing the way that you were delivering the services. Can you tell a little bit about that transition? And we've heard Juan speak to that already, as well as Maria, who has been using her Facebook Live channel or platform to reach many of her families. Teresa?
Thank you. So yeah, we had to go through quite a transition. Number one, our staff didn't have technology in their homes, right? This was something like they're used to coming into the office every day, working in the classroom with the parents and children, and we had all the shelter in place, so everybody had to go home. So the first thing was to get access into the homes of our staff and our educators. The second thing was also, recognizing the parents that we serve were under so much stress with the basic human needs and everything going on. We weren't even sure if they would engage. So we, through the needs assessment, we asked, and they wanted the support. Particularly because they were now at home all the time with their children. They wanted to continue to receive the education and to be able to continue to support their children to learn while they were at home. So our educators are fabulous, and in a matter of days turned their homes into classrooms. They literally, the backdrop behind them was filled with content-rich and developmentally appropriate images, and then they got their phones out and started recording themselves doing parenting lessons, doing early childhood education lessons, and doing our toy making lessons. So teaching parents how to make toys out of household products, and then giving them the guide to help their children learn while they play. So they did all this through videos. We wanted to make sure that we were recognizing that a lot of our parents didn't have access in their homes either. So we asked them what was the best way to stay in touch with them. And WhatsApp was one of the most popular platforms, as well as Facebook. So we started sending those videos out via those two different mediums, and parents were actually sending videos back of their children learning and their toys that they were engaging with them with. So it was absolutely fantastic to see how quickly they transitioned to create environments where parents could still learn, children could still learn, they could still stay in contact with one another. And I think a lot of them learned that they were not as, there was a lot of fear around technology and not being tech savvy. And our staff learned very quickly that they were. So it was a great confidence booster for them to, when push comes to shove and they had to do it, they figured it out really quickly.
That's wonderful. And a great segue to our next question. Next slide, please. And I want to start with Diego. As identity increased its focus on mental health and making sure that family needs were met, were there new skills that staff needed to build on to deliver those services? How did your organization support the staff in that process and do it quickly, because it all needed to happen basically overnight? Can you speak a little bit to that?
Yes, I first want to emphasize what Teresa mentioned, that I think that what your staff was able to do, similar to ours and probably everyone else, is a lot easier when you have the trust of the community. Because if they know us, if they trust you, they'll engage a lot faster than if you have to start a relationship from scratch. And something very similar happened at Identity, because when people know you and they trust you, they also are very forgiving sometimes when you are implementing things not from one day to the next. But what we did is that we have licensed therapists within the staff, but we have a staff of 75, and we trained all of the staff, frontline staff, on what we call community mental health. So things like active listening, anger management, how to control stress. We focus specifically on workshops for parents and how to deal with anxiety of the children, anxiety of the parents. We also have to retrain staff on mandatory reporting, etc. We also, at the request of the county, invited public employees, basically county employees, to also participate in our trainings in order to train as many people as possible with the ability to listen carefully to what the families were saying, to what the young children were saying, to act as filters, so that those who really needed it had to be referred to a licensed therapist. It was phenomenal because we enlisted all of our licensed therapists, but we also enlisted volunteers from the community, doctors who specialize in anxiety for children, anxiety for adults, depression, stress management, etc. So it took us within 2 or 3 weeks, we have done almost 16 hours of training, and all of our employees plus county employees, and then began the implementation. And with implementation, we also had to provide ongoing support for the staff. So it happened very quickly. Probably could have done it better, but overall, it really met the purposes, which was to provide the families with a sounding board. And just to clarify that what we did what happens naturally within our communities. No, you have the abuelita who listens, or the person who really listens. So we believed immediately that we did not have to be licensed clinicians in order to listen to people with an open mind and be empathetic. And it worked, really worked, and it continues to work very well.
Thank you, Diego. Teresa, as AVANCE also transitioned to its programming, you've spoken to this a little bit already, to its virtual format. What kind of training and support did your staff receive? I know it happened very quickly overnight. Can you speak a little bit about sort of and they were very innovative, it looks like. You have a great team. But can you speak a little bit about the services that you provided? The training, sorry.
Yeah, absolutely. So, you know, first of all, for a lot of our staff, the whole working from home thing was foreign, and it was their first experience ever having to actually work from home. And a lot of them have little ones at home themselves. And as Maria mentioned, other family members in the house and all of that. And so we recognized that was happening. The tech literacy stuff was happening, where it's one thing to give them a laptop and a hotspot. It's another thing for them to know how to navigate the whole system at their house. And then just the stress of everything that was going on and all the changes. So our staff came together and said, okay, let's really provide some really good support for our team. So we started rolling out a professional development trainings through our payroll system. So we knew that our staff would receive it, because that's where they go to, check on their pay stubs and enter their hours. So we sent out professional development on tech literacy. So tutorials on video conferencing, like learning how to do Zoom, Teams, all the different video conferencing platforms, because we knew that that's what they were going to be using. We also sent out information about tips for working at home, how to create your space, and how to balance your time, how to work from home while you're parenting and teaching your own children from home. And then we also did a lot around self-care for our own staff. So we had some meditation and deep breathing exercises that we sent out. And what we found out was, we did this process where we would send out the professional development, and then we would at the end of the week kind of do a survey, figure out what they've learned, but not only figure out what they learned and they liked, but ask them, what else would you want? And so we use their experiences and their voice to then develop the next round, so that the whole 3 months, it was very user-centered in terms of the professional development that we were rolling out. And what it's done is actually given us data that we should continue this process. They really engaged and they really liked the support. So that, that was how we managed supporting our staff and learning a whole new world.
That's wonderful. And it's the user-centered approach is definitely a very promising one. I'm going to go off script for a minute because we are getting a number of questions that are sort of coalescing around one theme. And I want to turn to Juan, in part because you already had a program that was providing services, remotely for your migrant farm workers. Can you talk a little bit about how did you train the families to, just as the staff needed to sort of go over the hump of getting onto this technology, many of our families did as well. Can you speak a little bit about that and where you might have built on technology that they were already familiar with, sort of, for example, WhatsApp or Facebook, the phones, for example?
Mm-hmm. Yeah, so I think our leadership started to take pretty quick tabs on how many of our folks had access to smartphones and connectivity. And from that, we figured that most of our folks that are being seen, I'd say probably about 90 to 95% had a smartphone with a camera built into it. So from that, we figured that it would be fairly doable to have our administrative staff. They did a really huge lift. I mean, you can't be saying how much work these folks put in, but reaching out to every single client that was active or a past client, like I said, back to 2019, and reaching out to them over the phone and helping to walk them through the process of downloading Zoom, and then explaining to them that process that I mentioned a little while ago, where you will receive a text with a link, and all you have to do is click that, and then you hit join with audio, and then they were able to do it. So that was a lot of the upfitting that happened. We also sent out some really funny staff-made videos where I think I even filmed myself acting as a client. I'm like, oh, I got a text from my therapist. What do I do? Oh, okay, I press this, and kind of, you know, just finding the thing, but doing them in Spanish, where it's these videos that are didactic, because there are Zoom tutorials and things like that, but not really in Spanish, and not really, you know, letting folks know how to handle themselves in a session. I think the other important piece for therapy is privacy. And like many folks have said, I think Maria mentioned, a lot of our families have everyone in the home. And that's not a always a viable environment for doing hard therapeutic work. So we often, came up with some flyers and PDF that we send out to folks via text about just general guidelines on finding a private place. More often than not, that private place has been someone's car, because in the house, there's not really a lot of private spaces. So we have a lot of, I've done tons of therapy sessions in the car, and they work really well. So a lot of those kinds of logistical things that you wouldn't think about until you were beaming into someone's home to do very personal, important therapeutic work. So I think those have been the key things, getting the families upfitted, and then really just a lot of support. Even we've got our group therapy program up and running as well, which you might imagine might be difficult to do a group therapy this way. But we've had a lot of admin support before, 10 minutes before people join the session, and then 10 minutes into the session, as we encountered it in today's presentation. There might be technical issues with sound and muting and those kinds of things. So those little supports have been critical in keeping folks engaged and feeling like this is doable and feasible for them.
I'm going to open the follow-up to the panelists. Does anybody want to build on what Juan said, or wants to offer a different approach that they've taken? If not, I'm going to pose the next question to Diego that we've got from the audience. Diego, how, and this might be different since you are serving first Latino youth and then their parents and families. How did you handle families that didn't have reliable Wi-Fi access? How did you circumvent that issue? Was it similar to what Juan did, which is that rely primarily on the phone, or did you have to do something differently?
So we relied a lot on the phone. Again, those who had access to more advanced technology like Zoom, we did it with Zoom, but WhatsApp is king. At least in our community, WhatsApp is king. And then the good old phone. The phone worked very, very well. Phone allows you to communicate at any time, any moment, and with very few families we will meet in person, but very, very, very few. But again, phone has been very reliable. WhatsApp is king, and then Zoom and others are almost a privilege, at least in our cases.
Maria, I want to pose a follow-up. Have you, and this can go to anyone as well after Maria speaks, have you had to assist your clients to get tablets or computers to be able to communicate them, or have you found that in general the phone is your primary mode of communication, and clients are willing to use that?
Well, we use primarily also phones and WhatsApp. Again, it's a very important way for us to communicate with our clientele. With our tablets, we have tons of tablets, but at this time we couldn't, because of COVID-19 and restrictions, we couldn't deliver them to them. So the best way to do it was increasing our focus on reaching our families via phone and WhatsApp.
Has been a good experience that people haven't had to go beyond the phones to be able to reach? I'm hearing nodding.
Well, I can tell you that with us, the school system here in Montgomery County provided tablets to all students. So that allowed us to communicate a lot more with the students. The parents, even when they had the tablets, they prefer sometimes the phone and the WhatsApp, using the phone to communicate.
Right. The next two questions are interrelated, and it talks to families that you may not be reaching. You know, we always are worried about the families we're not reaching. Juan, you talked about going to your books all the way back to 2019, even if families may not be active. That's certainly a way to perhaps extend your outreach. What have others done to try to get beyond, you know, the people that you know are coming and coming regularly, to get access to those who, you know, may not have been going, but really the need is high? And then related to that, how have you addressed concerns about public charge and immigration? And, you know, Juan, again, you spoke to that with the HIPAA confidentiality. Those are often interrelated. You know, the reasons why reaching Hispanic families is so hard is because of fear, language, etc. Can you speak a little bit about that?
Yeah, sure. So I think in terms of helping folks, I think it gets back to Diego's point about having trust in folks when they're engaging with you in these new ways. We've really benefited from that, in that folks have gone along largely with our efforts to reach out and reach them through telehealth. But we've also really leveraged just our sessions in particular. We really give mandates for our therapists. We have meetings. When this started, we were meeting 3 times a week, Monday, Wednesday, Friday, and providing consistent updates. And that's across all of our staff, but then we also have clinical updates. And whenever new laws or just come down, we create files that we share with each clinician that we then encourage the clinician to present to clients, whether that's pulling it up on the screen and doing screen sharing and reading it with them and explaining it to them, and making sure that the people we're seeing are up to date on all of these things. The other big outreach that we've done, or the big push, has been to try to combat a lot of the misinformation that there is out there. And as we know, also with our Latinx folks, there are particular risk for COVID. And also, I think the cultural piece fits into it. We're Latino, we like to get together with families and things of that sort. So when there's unfortunately poor information out there, folks aren't as aware of the dangers of getting together for a quinceañera or somebody's birthday, or any kind of cookout or things like that. So we really have made a big push on both on our therapy side, giving people that information directly, but also through our social media, through our Instagram account, through Facebook, and through our website. We're consistently putting out messages in Spanish about the dangers of COVID and the best way to keep yourself and your family safe. And we feel like it's so important to get at least a volume of those messages out there to combat the volume of bad information that can be out there that is causing a lot of harm for folks.
Thank you. Teresa, I'm going to pose the last question before we go to sort of a roundup and open it up for broader conversation. You mentioned that you were able to help families that were not eligible for the stimulus check, which I imagine was a good portion for many of you, that your families were not eligible for the stimulus, not the stimulus check, the CARES Act check. Can you talk a little bit about how you secured resources, funding to help families during that time, and continue?
Okay, yes, thank you. So we partnered largely, as I had mentioned earlier, with a lot of different organizations. Family Independence Initiative was like the key partnership in getting cash assistance. And then also even just with laptops and hotspots and all of that, we actually made a call out to the community for donations, and we do a lot of partnerships with the school districts to actually deliver our services, and we very much value those partnerships. And what ended up happening was the school districts saw our call to support getting technology into the hands of our staff, and actually lent us laptops that they weren't using because their teachers, nobody was there on campus. And so we were able to utilize that as well. And then for our families and thinking about access, because that's something, you know, that we all struggle with, I'm sure. And yes, they do have cell phones, but we wanted, you know, utilizing their own data and all this stuff. So we started thinking about moving into the future. We know that, you know, we're in Texas. Nothing's moving in the right direction for us to feel confident about opening back up again. So we really need to have a long-term plan for this. So we're looking at getting Chromebooks that already have data installed in it from Kajit, which is an education-based organization. And getting those Chromebooks to all of our families. Now that does require fundraising, but right now a lot of the foundations and folks in philanthropy are stepping up to the plate, and they're saying, how can we help? What can we do? And it's really important that our Latinx families have access. And so we want to make sure that we're providing them with that, not just to have access to our parent education program or early childhood education program, but also for a lot of other things that this is how we have to live life right now. And if we can provide them with a resource that would help them continue to connect and be able to fill out whatever, you know, online applications they need to complete, we're really excited to be able to provide that service.
Great. So I'm going to turn to, in the last few minutes, I want to open it to each of you to share with you what you think have been the biggest lessons that you have learned that you want to make sure that attendees walk away knowing. I'm going to start with Diego. Can you share what you think are the biggest lessons that you've learned from this time?
Thank you. I think there's a few. One is that, as I always tell my colleagues, is that we are in the business of building trustful relationships. Without trust, we couldn't have done half of what we did. And then trust is a transferable commodity. If someone that trusts us speaks to someone else, they will trust us immediately. So that is number one. Second is that relationship matters. Relationships matter. With foundations, with government, with the school system. At times like this, money is not infinite, and people choose who to give to. So long established relationships are very important, and that helped us in the past few months give out around $1.5 million directly to our families, and so that's extremely important. The other one to me is, and we all have done it, I'm just going to put it in words, but we need to stay relevant. All these organizations that are presenting today, they shifted on a dime to really meet the needs of our clients. If we haven't done so, we would have lost the train and our families would have gone somewhere else. And lastly is that all of us have invested in cultural and linguistical competency, which is, sometimes we take it for granted, but in crises like this, we see that it really, really pays off. And training, obviously, always being able to train the staff, etc. But those, to me, are the biggest lessons learned. Thank you.
Maria, I'm going to go to you next. What do you think are the biggest lessons that you've learned that you want to make sure folks hear?
Well, the online tools gave us the opportunity to bring groups from different geographical locations together online. You know, being in Chicagoland, people coming, or clients coming from the north and the downtown, from the south, from the suburbs, and even we had clients and participants who came from other countries, which that was amazing. So this diversity in the participants increase the different perspectives and needs. And it also allows us to reach the dialogue among the different backgrounds. So this is very powerful. Also, we had as a stereotype sometimes that all the generation and even low-income individuals do not know how to access the internet or the use of technology. But no, that's not true. It may be needed a little instructions and guidance, but they are quick learners and can do it. We should never think that we can't, because sí podemos. Yes, we can. And the last one is that we as family bridges and healthy relationships, we believe that relationships are crucial to make it work. But we did learn that you and I do not have to have face-to-face relationships because we can do it over Zoom and Facebook. And it doesn't replace the human contact, of course, but we can still make it very personal. That's what we learned.
Thank you, Maria. I'm going to turn to Juan now. Can you share what you think is the biggest lesson to come out of this time so far?
Sure, and I think I'll echo a lot of what Maria said. I think personally, or just like very specifically in terms of therapy, we found out that our folks, regardless of their knowledge of technology or access, they can do therapy, which is a pretty complex human interaction. It can be done successfully this way. And I've even done very manualized therapy treatments very effectively. And this has been across all age groups. And I think that's been really encouraging to see. Now, like Maria's saying, there are some folks that we haven't reached, and definitely doing therapy with folks that are younger than 10, it's a little hard to hold their attention when you're doing therapy online via video. But it has been very encouraging, and because of that, we've found that we've been able to actually be equitable in our delivery of services. As before, some folks, it was very difficult for them to rush from getting off of work at like 6 or 7 to make it to our clinic before we close for their session. Now they can just pull up their phone, or when they're at home and taking care of dinner or whatever, they can have a session on the phone. So that's been a really big upside in terms of greater access. Then I think the other more macro level thing that we've learned is the importance, and I think the Black Lives Matter movement has brought this sharply into focus, is the importance of advocating. And for those of us in privileged positions in terms of education, in terms of services that we can provide, really helping to advocate for our Latinx families. And particularly, we've seen this in North Carolina, with some of the schools where they have been overwhelmed. They don't have enough people that are able to provide interpreting services. Our families have less connectivity. So as things switched over to being remote, a lot of our Latinx students were being left behind. And I was surprised by finding that a lot of our mental health organizations across North Carolina that we partner with were the ones acting as liaisons between kids or their families and the schools, and really helping the families to advocate for themselves in these really hard times has been one of the more powerful ways that we've been able to intervene, aside from all of the therapy that we continue to do.
Lina, you're muted.
Sorry, almost got there. Teresa, can you also, take a minute or two to share what your biggest lesson is?
Yeah, I mean, I'm echoing a lot of what's been said. Particularly, for us, the resilience of our staff, their ability to shift on a dime, all in the name of making sure that our families and our children are safe, they're still learning, and that they have the needs that they need to survive and thrive. And so just watching them learn new skills, challenge themselves in the sense that they, like Maria and Juan were saying, like they thought technology was this big scary thing, and then they realized, like, oh, I can do this. I've got a phone, I can figure this out. That was really a beautiful learning experience, just to watch them and their learning. And the same with parents and how resilient they were in getting resources for their families. I think one thing we learned is that hotspots aren't enough. We work in very rural areas, and so you can put a hotspot in somebody's house, but if there's no tower nearby, the hotspot doesn't matter. So like Diego said, the good old telephone, even a landline, is really, it's still important to stay in touch and to use those resources that folks have. And then I'll just say partnerships. I know we've talked a lot about relationships and trust. For us, having those partnerships with other organizations to be able to bring in those resources was really critical. And as Diego said, it's not a one-time deal. You continue to build those relationships and keep that partnership going. So, yeah.
Thank you. We have a very, very engaged audience, which is incredibly rewarding. So I'm going to go right to their questions and get through as many as possible. Diego, I'm going to start with one for you. Have you found that the use of drug and alcohol use in children and young adults has increased during this time because of isolation, stress, mental health, you name it?
No, we did not see that. We have not seen the increase in substance abuse and alcohol use, maybe because people could not go buy it. But we did see an increase in domestic violence and also a huge decrease in the reporting of domestic violence. Unfortunately, particularly at the beginning of COVID, that forced the perpetrators and the victims to stay in the same house for long periods of times, exacerbated the situation. And speaking with the chief of police and others, they were really concerned by the drop in calls that they had. And we, speaking with our clients, we saw the increase. But in terms of substance use, we did not see that.
Diego, I wonder, in Montgomery County, where you're located, what were the alcohol stores open during this time? Have been open during this time, or were they closed?
To be honest, I don't drink, so I cannot tell you. I'm sorry, but I cannot tell you.
No. Because one of the key themes I've heard is definitely how policy has impacted how you all are serving your families. Let me turn to another question from the audience. I'm going to turn to Juan. Can you share a little bit about the misinformation that you mentioned? Where are people getting this information? How is it playing out in the communities? How are you tangibly addressing it?
Yeah, so I mean, I'll just mention anecdotally from what I've heard from our clients. I think word of mouth is a big issue where folks will hear it from within the community, and then, as we say in Spanish, corre la bola, or the ball runs around and the word gets around. I think Facebook is honestly a huge source of misinformation around these things. But I think what we've seen, at least in our area with Univision, has been, I know a lot of our clients watch Univision on TV, and they've been doing a good effort, making a good effort of getting good information out there. But yeah, I mean, in terms of how we've addressed it, is like what I've mentioned before, really making sure, I mean, daily we have 2 to 3 posts about COVID, how to keep yourself safe, how to keep your family safe. I do every time, I think a lot of our clinicians, every time we come into our session, we're going to say, hey, how are you doing? How's your family? Is anyone sick? Trying to get them help if they are. And then we always make sure, hey, are you wearing masks? Are you not congregating with people? And it can be a difficult thing because sometimes, like, I have a kid who really is excited to go to a quinceañera party. I'm like, well, maybe, we can hold off on that. And he doesn't like to hear that, but it's those kinds of things where you're kind of trying to battle this tide of information that's out there. And all you can do, I think, is just consistently message in the same direction.
Thanks, Juan. Maria, I have a question directed towards you, directed to you and your program. What has been the biggest challenges that you faced in providing services since COVID hit in March? We can't hear you. I'm going to turn to Teresa while we get your audio fixed, Maria. What has been the biggest challenge that you faced?
Balancing the shift, I think, to make sure you're meeting the needs, the basic human needs of our families, and then also ensuring that our education program continues on. I think balancing those two things has been quite challenging. And I'll be honest, the biggest challenge right now is because we are an education program that follows the school district calendar, we go pretty dormant during the summer. So we're sitting here now and really thinking about what do we do in the fall, listening to all the school districts and their plans for opening, how they're planning to either do virtual or hybrid. We are so fortunate. Our staff is so smart and they're ingenious. And we've now been a little bit more strategic about, we call it, we did reactionary virtual in the spring. Now we're doing strategic virtual, where we actually went back and looked at our curriculum and we're creating, using Google site, we're actually creating a parent-facing virtual program that allows them to interact with the information at home or wherever they're comfortable, wherever they can on their own time. And then it also still includes a social component. One of the biggest outcomes of our programming is increasing social capital, people connecting, right? Making those relationships with other people who have lived experiences. So how do we add that? So we're kind of figuring out how to do a blended model. But I think it was just really pushing ourselves to think through, in this new world, how do we continue to meet the needs of the families and the children that we serve? And so I think it's been challenging, but it's also created an opportunity for us, like Diego said, to innovate and to really think about modernizing what we're doing and making sure that we're relevant.
Thank you. Maria, is your audio back on?
Yes, it is.
Oh, perfect. I'm going to pose a different question for you. Have you seen that families that have been experiencing stressors and definitely have need, but calling the police because of domestic violence or what have you, but they also at the same time fear deportation? Have you seen any of that in your community?
Well, we know in our community that happened a lot. The groups that we were serving, they were going to some of the domestic violence issues. And then, as well as Diego suggested, I know that they were taking care of the issues. So they called the police, some of them they called their pastors and they asked for interventions. So we know that that was going on, but after the events or the violence passed. But they didn't contact us in that specific moment because we understand that when those situations happens, sometimes it doesn't give time to call us. They call others like police or other assistants. Yeah, but definitely in the Latino community in Chicagoland, it increased not only the domestic violence, but alcohol use and the stressors were multiple.
Diego, I'm going to pose the last question that I can fit in for the audience. This is one of those hope springs eternal. Do you think that the crisis will help reduce the stigma about mental health now that we're really understanding how everyone's mental health can be affected? Given the public health crisis, racial justice, economic, what are your thoughts, reactions to that?
Are you asking me first?
Yes, Diego. Yes.
Okay. I don't know. I would tend to say yes, because our families have suffered so much that we tend not to focus on what others might think anymore. So the pandemic and everything that it has brought to our families helps put things into perspective. And so I think that it could have a positive effect in terms of eradicating some long-term stigmas, but we will have to see. That stigma has been created over centuries, particularly during the very machista culture that we have. I am hopeful, but I'm not sure.
And we're at time, so I want to thank each of you, Teresa, Juan, Maria, and Diego. Thank you so much for taking the time, and for everyone who's attended. We're going to be, again, sharing the recording on our website later next week, and we hope that you visit our website for future webinars like this, to learn more about future webinars like this, as well as some of the resources that we have available. Thank you all.